Hi, everyone. This is Kate with Scottsdale Moms, and today I am joined by Dr. Ali Thompson from Phoenix Children's Pediatrics. And Dr. Ali, thank you so much for being with us. We really appreciate your time.
Thank you so much for having me. I'm so glad to be here. I'm very excited to speak with you.
Oh, thanks. Well, I know you're with Phoenix Children's Pediatrics,
Mhm.
so tell us a little bit about how long you've been with them and all the good stuff.
So I've been with the organization for about 4 years. I have done my pediatric residency here, and then I stayed on an additional year after I graduated residency to be a chief resident. And now I'm joining the pediatric side of Phoenix Children's.
That's amazing. I love that. Yeah, I think for a long time when I first moved to Phoenix, I knew of Phoenix Children's Hospital just from driving by it,
Mhm.
but I did not realize that they have an entire pediatrics organization right here in the Valley. So that's an amazing resource that we want to make
Yeah.
sure our moms in the area know about.
Mhm.
And so you are taking new patients are at your office?
Yes, I am. I would love to see, everyone in the Phoenix area. I'm really excited to get my foot in the door and kind of start to learn about all of the different people here. So I am very excited to build my patient panel.
Oh, that's fantastic. Well, it's such a special place. There are so many families and so many young families. I'm sure you'll have your hands full soon. Well, today we're going to talk to you about how to treat diaper rash and other tips from a pediatrician. And I understand this is going to be a perfect topic because you're a mom yourself. And how old is your
Yes.
kiddo?
She is 18 months old. So we're still in the diaper phase. I
Oh,
totally get this.
oh my goodness. Okay, so tell us all of your tips and tricks. I had one that I still remember. It was really bad. We even had to stay away from certain brands of diapers because there seemed to be some sort of reaction there.
Yeah, I mean, that's definitely possible in terms of like the different diaper brands and then also even wipes. Some kids just can't deal with like a scented wipe or certain types of wipes. The skin is a very like finicky area, right? Especially in the diaper area because it's so moist. So that can like breed rashes. I would probably say the biggest thing is that you want to catch it when it's early. So if we see a little bit of redness, you want to start putting on some Aquaphor or Vaseline. They're essentially the same thing.
Oh,
You don't have to be
okay.
fancy and get Aquaphor. If you have some good old Vaseline at home, just kind of lather that on. But if you notice that it starts to become a true rash, that's when you want to step up your game a little bit and maybe look for some zinc oxide. Um, I would probably say the most common zinc oxide would be like Desitin, like names that you've heard before, but they come in all different tubes, all different types. There's like burp bees, there's many different types. And really what you want to look for is just zinc oxide. You can do as low as like a 10% up to 40%. The 10 to 13% is kind of like your daily defense. So some people will just put that on daily just to kind of keep their child from getting a rash, so just preventative care. But if there really is truly a rash already, you want to go to your 40% zinc oxide, and you can just buy that over the counter.
Oh, good to know. Okay, so with the Aquaphor and Vaseline, and I'm asking this only because I know if I understand how something is happening, sometimes it helps me remember what to do. So,
Mhm.
what is that Vaseline or Aquaphor? What is that doing to prevent the diaper rash?
It's just giving a barrier to the bottom. So a lot of times if you have a lot of like they've been sitting in their diaper all day, they just have like all that urine and that can just breed irritation to the skin. So if you can get a barrier cream, that's what we really call them, is a barrier cream, just to kind
Okay.
of put on the bottom to kind of to protect it really, just in case you can't get to changing them or they're getting irritated by something else. You just want to create a barrier of protection.
Awesome. That makes perfect sense. Yeah, once I understand something and I'll remember that barrier cream, then
Mhm.
it's just easier for me to know what to do and
Yes,
remember what
yes,
to do.
yes, yes, definitely. And I would say also, like, remember that fresh air is like your best friend. So you want to make sure that in the middle, like when you're done changing them or in the middle of changing them, you kind of let their bottom air out just for maybe 30 seconds or a minute. A lot of times, some wipes are just so heavily saturated that it leaves their bottom a little bit wet. And then that can kind of add to worsening the rash. So you kind of want to let it air out a little bit, then put on your barrier creams. If they have a true really bad rash, you want to do the zinc oxide first, and then you can put a little layer of Aquaphor over it.
That's awesome. I remember with one of my kids, we used to put beach towels down on the floor at night
Mm-hmm.
and just let them hang out there. Um, because it would get so bad that I feel like that was the only thing that helped was just naked time on the beach
Yeah.
towels on the floor.
Yeah. And there's nothing wrong with that. Sometimes that's what you have to do just to kind of give that area time to breathe and heal.
Yeah. Oh, that's good to know. Okay, so being a new mom, what other tips and tricks have you learned that are just fantastic that everybody should know?
I'd probably say just go with the flow. You know, it's easier said than done, but sometimes we just get so hung up into like our routine. And if we're like 10 minutes off, it's going to ruin this or that. But a lot of times, like your child is not a robot. So, you know, just kind of go with the flow. They may have like a tantrum and you have to divert from whatever you were going to do next. Or, you know, you may be 10 minutes late for nap time. And I think just to kind of help, you know, mama and baby, just take a deep breath and kind of go with the flow. And I think that's what I've learned the most being a type A person is that I can't plan everything out. And my child, she has her emotions. She's a whole different person than me. And so just kind of letting things go. And that has like made the world of difference for me.
Okay, I needed you in my life 23 years ago with my oldest because I would get so rigid about schedule,
Mhm.
especially like her nap or whatever it was. And I can remember one day just being in tears because we were late for her nap and she had fallen asleep in the car. And I knew that meant that I probably wouldn't get any rest that day. And
Mhm.
I can just remember having an absolute breakdown and my husband being like, it's okay. We can just move her from the car to the crib. And I was like, it's never going to work. You're going to wake her up. And
Mhm.
he's like, and if I wake her up, I'll sit with her and you can go rest. And
Mhm.
so thank you for that because I think we have a tendency, especially as a new mom, there's so little you feel like you can control and you're just out of control of everything. Everything's
Yes.
changed. Your whole world is a little upside down in a beautiful
Mhm.
way, but it's upside down.
Yes. Mhm.
And you do need those reminders of just breathe, go with the flow. Yeah, they're not a robot. They're not.
Mhm.
Yeah.
Yeah. And I mean, like, don't get me wrong, a routine is necessary to get through your life, but it's not, you don't have to hold on to it so tightly that when things, like you said, like, you know, you don't want to crumble when you're a little bit late for something.
Yes. Yeah,
So that's more the point. It's just, you know, sometimes we just got to go with the flow.
we really do. We need that.
Yes. Yes.
That is awesome advice. So, especially for you new moms out there, be sure you call Dr. Thompson, make an appointment because she is going to understand exactly where you're coming from and know what tips to help you with to make it through these next couple years of your beautiful
Yes.
baby.
Yes. We got to stick together, us mamas, you know?
We do. We do. I can remember somebody telling me that it was like a club, and I thought, that's a weird thing to say. Like,
It is.
what does that mean? And then after being a mom, I was like, okay, yeah, there were things that there was no way I could have related to until I had walked
Yes.
through it, like the sleep, like
Hmm.
just your time is no longer yours, which I think is such a beautiful lesson for us to all learn and grow and mature. But it's not an
Hmm.
easy lesson, and we sure do
No,
need each other.
it's not an easy lesson. And I think that, you know, I was a pediatrician before I had my daughter. And I was pretty good at my job, but I have to say that I have a different level of understanding now because I've been in the weeds and in the thick of things just with like my patients. So there's a level of empathy, like I just totally understand where they're coming from. So
Yeah.
it's definitely been a very it's been a eye-opening and humbling experience, but I'm so glad that I have it because I can just, we're in this mama tribe together.
Yes. You understand that for some reason it really can take 45 minutes to get out the door from
Yes.
from your living room to the car is a
Mhm.
whole adventure,
Mhm.
depending on the
Yes.
day.
Yes, for sure.
Oh my goodness. Well, thank you so much for spending time with us today and letting us know some tips and tricks about diaper rash. And we're so glad to have you in the area and really look forward to hearing from you again soon.
Yes, for sure. I'm so glad that you asked me to talk about this. I did realize I forgot to say one thing.
Yes,
If
please.
you have a really bad diaper rash,
Yes.
whenever you're changing their diaper, make sure that you don't completely take off the zinc oxide or the aquaphor that you had on before.
Oh,
You just want to really take off that top layer because if you're continuously, pulling off and irritating the skin more, it can get worse. So we really want to have that barrier there and just really just take off the very top that you need that's soiled, but everything underneath, just leave it on.
okay. See, I needed you in my life. So, moms, take advantage of knowing Dr. Thompson. Take her hints and tricks because they will save you a lot of tears.
Thank you so much for having me.
Oh, thank you. Have a wonderful day.
Thanks, you too.